My name is Pauli Suba, filling in this afternoon, 477-5757. I've got some friends in studio right now from GRMC, and it's Dr. Michael Agustin. Agustin?
It depends. Like Agustin, I've been using that when I was in the U.S. But in the Philippines, like it's Agustin.
Agustin, a pulmonologist and critical care physician. And Miss Dr. Michele Yamamoto, MD, of infectious disease physician, and the two are married.
Yes.
Happily married, right?
Yes.
Both are from the Philippines. They have their medical degrees at the University of Santo Tomas.
Exactly.
They both speak fluent Tagalog. They both completed their medical educations at prestigious university teaching hospitals in the New England area.
Yes.
And first we want to ask, how did the two of you meet?
We actually met in the latter part of our medical school.
Yeah.
When you're training, one does the delivery of a baby and the other one catches the baby. That's how we met. Like she was delivering a baby when we were training, and I was the one catching the baby after it was delivered.
Yeah.
And so, like, you almost dropped the baby and she got mad at you?
No, it was a tough night at the time.
Really?
I went to the delivery room because, like, we've been having, like, in the Philippines, we've been having an average of 60 deliveries in a shift.
Yeah.
Wait. Not in a day? In a shift?
In a shift. This was in the government hospital.
Government hospital.
It's a popular
60
government hospital.
Yeah. So
60 babies in a shift.
Yeah.
Yes.
So you were meeting a lot in that shift.
And I got frustrated and went to the delivery room and said, like, hey, who's the doctor delivering this? Like, I only have one hand to
Slow it down.
Slow it down.
Slow it down.
I can't slow it down. Like they need to pop the babies out.
You were probably very upset, and then when you saw who it was, you're like, never mind.
Exactly.
Would you like to have lunch?
Yeah, but it was ironic because she asserted herself, and that's where it caught my attention. Like, hey, this doctor asserted herself to me. Then actually that morning when we were about to leave the hospital, I met her at the parking lot and asked her, like, hey, you could just like hop in and I could just bring you to your dormitory.
Yeah.
That's how I actually met.
Yeah. That's how
And
we
you
met.
were like, you didn't be like, who is this again? No, absolutely not, sir.
I was actually thinking, then I'd save money if I didn't have to use the cab.
Well,
But then
you worked together, so
we worked
obviously
together, and
you knew that he's a cool guy.
24
Never
hours.
dropped a baby the entire shift.
24 hours we worked
Exactly.
together, and I said, it's the end of a long shift, and he actually said that it's the end of a long shift.
And people get frustrated, get mad, but at the end of the day, it's a part of a training.
Yeah.
Right. Very nice. Dr. Agustin, tell us a little bit about your background and education.
Okay, so as you have mentioned, we both graduated at the University of Santo Tomas in Manila, but I did my pre-medical course up in the northern part of the Philippines, which is St. Louis University in Baguio City. Then both Michelle and I completed our residency training. That's after your medical school at Brown University in Rhode Island. Both of us took internal medicine. And I did further training in pulmonary and critical care. Critical care is like ICU medicine at St. Elizabeth Medical Center in Boston, which is also affiliated a teaching hospital of Tufts University.
So before you even met, but the both of you already had similar interests.
Exactly.
Obviously, because you're in the same field.
Exactly.
So was there a little bit of opposites attract in the beginning, or it was just like, boom, your favorite color is blue, my favorite color is blue.
Well,
you love pizza, I love pizza.
Both of us loved internal medicine.
Yeah, we like internal medicine.
But I think further in our training, that's where we defined like what field would we want to specialize, and I worked more on people with lung disease and also on the ICU, and she works for people with infectious disease. But come to think of it, it's actually a partner because most people with lung disease and patient in the ICU end up having infection, and I have my wife very handy on helping me on this.
Nice. Yeah. Who was helping the other get through the tests and whatnot? Who was struggling more or whatnot?
I would say like both of us are co-equal.
Really?
That's how we
you
treat
leaned on each other the whole time, the entire time? Nobody's the alpha?
No, we actually studied together.
Yeah?
That is, people would ask us, did you study separately? We said no. We actually shared books.
Yeah.
Sure.
We shared
Exactly.
books and we studied together for the board exams.
Exactly. And then I think that's actually one of the things that's good about medicine. If you have a study partner, the better you go.
For sure.
Yeah. Yeah. Someone to power you through nights when you just can't do it anymore. No. You have to read some more.
Exactly.
What about stink eyes from the others? Those two again. Always those two. None of that.
Always
Like
those two.
like people frown. They're together and stuff like that, and they're what I'm trying to say is, like, in private businesses, right? It's somewhat frowned upon that there's a relationship with two employees.
Yeah.
Exactly.
Do you get that?
No, I think what's
Not here. Don't tell me here, but
Yeah.
like in the past.
Yeah, I think it's more of projecting ourselves into a complementary individual, both in the professional field and also like our outside of our
Yeah.
profession.
Mm-hmm.
I think that's how people looked at us, because I always had been very proud of my wife, and I tell them, like, hey, if there's anything, if any problem in the ICU with regards to anything infectious related, then I call my wife. I think treating her would be, I think, having my whole trust and my whole confidence that she had trained in the best institution makes us more of a complementary
For sure.
package deal partner, more than just to be taken as an individual.
Right. For sure. Dr. Yamamoto, tell us a little bit about your background in education.
So so Michael's from the north. I hailed from the city. I did my undergrad at the same university, at the University of Santo Tomas, and then pursued my medical degree with Michael at the medical school, and then Brown University for residency, and then of course going on to University of Massachusetts in Worcester for my fellowship program in infectious disease.
There's a lot of benefits with the two of you doing everything together. I mean, you guys could be on the carpool lane to get to work, right? You didn't have to commute, be stuck in traffic.
Exactly.
Yeah.
Exactly. Yeah.
But what about shifts, though? Because obviously not all your shifts are going to be at the same time. So you might be at the hospital and then your husband's at home and vice versa. So how would you find time to have a personal life?
What we've actually found useful is weekends.
Weekends.
The life that most of the people in the medical profession can relate to is, it's a life of always being on call anyway. So
and selfless.
Exactly.
You must be selfless, right?
Well, it's one of the noble. We tend to think that it's one of the noble professions around.
Of course.
But again, to each his own.
Yeah. And then let us put it this way: like, there's a learning curve on how to adjust your, and then that's actually being molded, especially when you're together in medical school. Like, when you're in a relationship in medical school, you tend to have less dates, you tend to have less time together, and that carries over when you're working, and you tend to understand it more. And this is the profession that we actually had chosen, and we find fulfillment not only in our interpersonal relationship, but when we see each other, we also find fulfillment when one actually talks about her and
each
his
other,
job.
yeah. Because whenever I ask a patient, who's your lung doctor, and the patient goes, Dr. Agustin.
Do you automatically say, or do you kind of wait and see how they think of your husband?
I sometimes I actually wait. Sometimes the problem is
that Dr. Augustine.
I
He's so rude.
I haven't gotten that, no, and I don't think I ever will. But sometimes when the nurses haven't said that, the other doctor that's going to look at you is the husband or the wife of X and such. But no, I think we've devised a way to try to make time. Even if it's at work. Lunch or...
And that's the benefit too
That
of if you do have the same shift together.
Exactly.
Then you got break time together and whatnot, or stressful day.
Yeah.
And all it takes is a look from your husband or your wife, right?
It's gonna be okay.
Yeah.
Sometimes you just need a look. You don't need words like, shh, I don't want to hear it. But all you need is a smile and to a familiar face. That's there's so much stress that I can only imagine that goes along with your professions.
Exactly.
And the fact that you have your husband or your wife in the same building, in the same not necessarily exact profession, but in the medical field, then the two of you can lean on each other and be each other's support. And you understand each other.
Yeah. And it does not only like go into like a couple's relationship. I think knowing more about these time constraints in the medical field would let you understand more also the needs of your colleagues, because some of your colleagues might need a time off to be with their sons or daughters. Some of your nurses might not come to work, and you understand like, hey, this is our time.
It is true, because people in the medical profession, how noble the profession may be, sometimes we forget that we too have lives to lead.
Yes.
And that is important. We always get reminded at work that is important, because that is what feeds you and what fuels you to go through your work. Work is there, it's part of it, but family too, and interpersonal relationships are a big part of it.
So why did the two of you decide to come to Guam and work at GRMC?
That's a very nice question, Pauli. So when people ask us like, hey, you're going to this small island, and it's funny, because every time after our training, when people ask us like, where are you going? We're going to Guam, and you would see that blank stare on their face, like Guam.
In South America?
Exactly. Then they try to like, where is Guam? They could see like they're trying to figure out where it is. So every time I tell them like the choice of this depends on two things. Like in the medical profession, we choose a job on where you feel like a best fulfillment that you've done medicine.
Okay.
And the other one is that where would you have the best impact with your career.
So there is a need for both of you here on this island.
Exactly.
Got it.
And then some people find fulfillment, and some people would actually have a better impact on either on an academic institution, big institution, either local or big institution in the U.S., or some people like us, and me and Michele, that finds ourselves that we have a better impact to the community and a better fulfillment when we come to this place that we know that the demand for doctors are great. And I think getting to know more the community is actually, this is old school medicine.
Really?
Yeah.
Okay. And you recently moved to Guam, September. As early as September. Are you already acclimated? How the weather, has been tough.
Yeah.
We
You've been longing for this.
Being born and raised in the Philippines, this is this is home. The weather is home to us.
The rain's not really. It's been raining. I'm trying to find a open day to do my yard, because my grass is getting high.
We're so used to hot and cold, rain and sun, because that's how it is back home.
Okay.
This is very welcome change from snow, right?
Yeah, we'd rather trade snow from.
We'd rather trade this
rain from
for snow.
Okay.
Yeah, it's always pretty to look at in the pictures, but once you have to shovel snow, that's almost as tall as you.
Yeah. I grew up in Oregon, went to school out there for high school, and we had one of those plow machines.
Exactly.
It broke, and then I was the plow machine.
Yeah.
Had to do the sidewalks and whatnot, and I was like, I can't wait to go home to Guam. I want to go home to Guam. So you do. I know exactly what you're talking about. The pictures are you're like, oh, I want a white Christmas.
Exactly.
And it's a little bit overrated.
I know.
Yeah.
But so. Dr. Agustin, what does a pulmonologist do?
Well, a pulmonologist, like for a layman's term, is a doctor for the lungs. Okay, so we cater on illnesses that concerns the lungs or the breathing, to be exact. Most people in their lifetime had been told like, hey, or have heard diseases like asthma, which is very common. Disease from the young, it actually transcends to an older age. Smoking-related diseases like what we call the COPD, which is chronic obstructive pulmonary disease, that we tend to see it in the older population who have smoke, or emphysema. I know some of you have heard like, hey, my doctor told me I have a fluid on my lung. Those are also diseases that we cater into. Most of all of us at our lifetime had developed pneumonia, and then these are an infection.
Right.
Like, this is an infection of the lung, which also part of the the pathology that I see. And so those are the most common things that we see in our clinic. And of course, one of the biggest concern nowadays is lung cancer.
Yes.
And my partner, Dr. Gonzalez, and I are really pushing on this cancer awareness. And I know people here in the island had also been very, and primary care had been very active on letting people know that
there's a high rate of cancer on this island.
Exactly.
My son actually has sports asthma.
Okay.
Right? So he doesn't necessarily have asthma, I guess. Can you explain a little bit more?
Yeah,
For me, as a father, I'm not, he has to carry around his inhaler, right?
Exactly.
And, but they kind of describe it as sports asthma is not that big of a deal.
Exactly. So asthma, in a broader term, it's like you have an air pipe, or your pipe that carries the air from your nose to your lungs actually is hyperreactive, so it reacts so much to the point that it constricts. But asthma on a broader sense has different triggers. Okay, some people would have infection trigger. They have colds, they have upper respiratory tract infection, then they triggers their asthma. Some people like your son would have an exertion related, like when they're tired, that's the time that their asthma actually triggers. Right. And people like work related, like dust or anything like that, fumes or construction material that they inhale actually triggers this hyperreaction in their air pipe. But so it's mostly a hyperreactive air pipe that's triggered by different things.
Thank you, Doctor. My name's Pauli Suba, 477-5757, filling in this afternoon here on News Talk. I am with GRMC's Dr. Michael Agustin and Dr. Michele Yamamoto, MD. They're married. They're an amazing couple, and they're here on island. They just moved to the island in September, and they are practicing up at GRMC. And we last were talking about the background and education with Dr. Agustin, and now we want to ask Miss Dr. Yamamoto about your background. We've already asked your background. We want to ask about what infectious diseases that you specialize in.
So infectious diseases is a broad topic, is a broad subspecialty actually.
Okay.
In a nutshell, it's an infectious disease doctor is a doctor that deals with anything that is related to an infection, like a bacteria, a virus, a parasite, or a fungus that causes an infection, causes illness, and can be communicable. Some of it are communicable, to people. The infectious diseases that are most commonly heard or most commonly dealt with by an ID doctor includes but not limited to HIV, AIDS, tuberculosis, hepatitis, sexually transmitted diseases, diseases that people get when they travel abroad. And in the hospital, it's a sort of like a different setup, but diseases that when people have bacteria in their blood or bacteria in their urine, most of those things. Yeah.
So it's a not specific then. There's you specialize in a broad amount of infectious diseases. So you're seeing patients that could have a number of infectious diseases, hepatitis.
Yes. Luckily, we always say that fortunately sometimes most of the time we see people with one infection, but it doesn't, sometimes you see a patient with one or two infections, but yeah,
because infection that's left untreated can be complicated, and it spreads to the blood, and
then body. Causes then they might see you for pneumonia.
Exactly.
Yeah, or they might end up in the ICU when they're really, really sick.
Right.
If the infection,
because things start to break down, their lungs get infected, and they'll come and see you, and then both of you may end up working together to treat one patient, right?
Exactly.
Actually, it happens all the time.
Oh, it does.
In the ICU.
Okay.
When patients are really sick in the ICU, because you fix one thing breaks down, and an infection can cause a person's body to shut down, and they end up in the hospital or in the ICU.
Yeah, and I think that's the trend of medicine now, and that's what we're promoting at GRMC. That it's as a hospital, you have a lot of subspecialty physicians
Yes, that work together.
As a team.
Yeah, it's a group that works together, not just separate arms. It's part of a whole team, not centered on the patient, with multi subspecialty care. So
your story is special. I am intrigued more and more. The longer I talk to you guys, I am very intrigued by the both of you, and you're such a blessing. I'm not even joking. Like, it takes a special person to get into the medical field. It takes an extremely special person to get into your field because when somebody has a cold, even I back off quick. You know what I'm saying? I'm like, oh. Especially even in media, I'm a morning radio personality on our sister station, 105 The Cat, and if somebody before me was on the mic, I'm like wiping it down, with the wipes and whatnot, and spraying and stuff. So the fact that you go in every day and deal with people, they need your care. Right, but how mentally? How is it that you're able to continue to do the profession that you do without a concern really for your own livelihood?
Actually, I would like to think that all of us in the medical profession are like that.
Right.
We and it's a matter of what you would love to do. Like if he loves to be with the sickest of the sick people in the ICU.
Right, because all of you are going to be around infectious diseases.
They're going to be around infectious diseases. And to be honest, I'm actually thankful that that the Lord Almighty gave us a good immune, at baseline, like good immune systems to be able to fight off these infections that, even if someone's sick beside you, it's not necessarily that you're going to get sick from that person. Like I always tell patients, you have to try to be healthy at baseline to try to help your body fight infections. Of course, there is, if it gets to a point that you need some medication, there are medications available for most of the diseases, infectious diseases that we have, but the prime defense of the body is just to be healthy, to try to be healthy.
Yeah, and then on the broader side, I'll put it this way. So every time I see a sick patient, like health is a very, very vital factor in a person's life. Like it does not only affect the the person who is sick, it also affects the work, also affects the other family. So the sooner we treat this patient, other social issues that underlies on this would also get treated,
get solved. Because when a family member gets admitted to the hospital, someone will be there to take care of the patient. That particular someone will be off work, wouldn't be able to see and be with their family. So it's really that maybe a small problem, but it sort of evolves into a more social issue when the patient gets into the hospital. Not just the medical side of it, but
and then
also as a whole.
And the more challenging part on this is we are in the island, so the next help would be a plane away to the nearest U.S. hospital, which is Hawaii or LA or the West Coast. So we have to make sure that we're on the last field of treatment for this patient, and we have to act fast, and we have to be so vigilant on things that can happen.
Understood. Dr. Agustin, this month is National COPD Awareness Month and Lung Cancer Awareness Month. What is COPD?
COPD is, just I mentioned, it's a chronic obstructive pulmonary disease. It's actually an illness that we see in the elderly who had smoked for a long period of time. And this month is it's actually a way for us to understand this better. So for those people who had been smoking, and in the latter part of their life find themselves having shortness of breath or cough or things like that, I would suggest to see a pulmonologist so we could actually try to test you. And we have a breathing test at GRMC, so we could categorize that. And again, the lung cancer, as I mentioned in my previous interviews, is it's a number one cancer death or factor or number one leading cause of cancer death worldwide. Okay, and the best way to actually to battle this is to screen people.
Yes.
So for all listeners, like if you're age 55 to 77 and you've smoked for 30 years, a pack a day for 30 years, or 2 packs a day for 15 years, and you haven't stopped for 15 years, please try to reach out to your primary care, to your pulmonologist for you to get screened. It's just a matter of having a CT scan of your chest. It's a very low dose type of radiation. And then the earlier we can get these small nodes or masses, the better is the chance for treatment.
Thank you. We've got John. He wants to get in real quick. We don't have much time left, John. So thank you for your call.
Yeah, I know you're both practitioners, and thank you for your service to Guam. But are you concerned as a medical professional that the insurance issues that are striking, even locally, are becoming kind of they're deteriorating the health situation on Guam because families are avoiding going to the doctor? I'll get off the air and hear your comment. Thank you.
I really wish we had enough time to. That's such a dynamic question.
Exactly.
Do you have a short answer or not?
Well, of course, like when we see patients, like we're trained not to look into if they have the ability to pay or not.